Hello, everyone. Welcome back to Reversing Hashimoto's and Thyroid Disorder Summit. I'm your show host, Dr. Anshul Gupta, and I'm really excited about today's discussion. The person I have has tons and tons of knowledge about various disorders, especially for thyroid. He has the most innovative treatment that can help you with your Hashimoto's and thyroid disorder. So, let me introduce our speaker first, and then we will delve into the discussion after that. So, Dr. Kent Holtorf is a distinguished medical director of the Holtorf Medical Group, has been a beacon of innovation in healthcare as a pioneering force behind the National Academy of Hypothyroidism and a visionary founder of integrative peptides and peptides. His dedication to pioneering advanced peptides and bioregulator therapies has transformed treatment landscape for a myriad of complex conditions. His expertise spans from tick-borne illnesses, chronic fatigue syndrome, fibromyalgia, MCAS, long COVID, neurodegenerative diseases, hypothyroidism, especially undetectable by standard thyroid function tests, and also in hormone optimization. Dr. Holdorf's contributions as an internationally acclaimed lecturer, educator, and thought leader are unparalleled. He has influenced medical education globally with nearly 100 lectures at CME approved medical society conferences worldwide. He has been featured in CNBC, ABC News, CNN, Fox News, Good Morning America, Today Show, Discovery Health, The Doctors, The Nerling Channel, The WebMD, and multiple more. Dr. Holdorf, we can keep going, but welcome over here to our show today.
Yep. Now we're out of time. Thank you, everyone.
Absolutely. Yes.
Thank you so much. It's so kind of you.
Yes.
It's a pleasure to be on, and I always love talking about thyroid because you fix the thyroid. I mean, so many people are low and are undiagnosed, as you've been saying for many, many years. And I follow all your stuff. It's awesome. And this whole podcast is great. So thank you.
Absolutely. So let's delve into the discussion. So I would like to kind of say you founded this integrative peptide. So first of all, why don't we talk about, your illness in medical school and your residency that led to your interest in your thyroid and peptides? How does that happen?
Yeah. So, I was very evidence-based. I'm still very evidence-based, but in medical school, it's ingrained in you not, anything alternative means no evidence, right? And so I started getting very sick through medical school, and it was something was wrong. I just couldn't tolerate any stress. Talking to a patient was just overwhelming. I'm like, I don't think I can practice medicine. Went to all the university doctors. Oh, you're depressed, you're stressed. I'm like, no, there's something wrong. And then I went into anesthesia because I figure, okay, you don't have to talk to them, they're asleep, right? But just started circling the drain, and then so I said, oh my God, I'm gonna sneak out and go to an alternative conference. And I'm like, oh my God, this is more evidence based than all the crap they're teaching us in residency, right? And one of the big things was thyroid optimization, also mitochondrial dysfunction and some immune modulation. But the big thing was T3 and optimizing thyroid. My thyroid was particularly normal, but oh my God, it just helped so much. And so I was able to function again and it saved my life. But it didn't fix the total underlying issue. So a number of years later, went through a stressful divorce. Stress is a killer with the immune system, and just ended up. I had Lyme, Babesia, Bartonella, and my heart became fibrosed from what happens with basically, especially Babesia, but also Lyme. You get high human transforming growth factor beta. It's very fibrotic, and my heart was just fibrosed. It couldn't fill and was in heart failure. I couldn't stand up. I couldn't walk upstairs. And I'm like, okay, living with Lyme is horrible, but with congestive heart failure, it's unlivable. So I said, I'm not going to continue after Halloween, right? But I said I will go around the world and see if I can fix myself. Did a lot of unique treatments that help, but nothing really lasted. And I was in Belgium and I did a bunch of peptides and I didn't think anything of it. I didn't know much about them. And then like 3 or 4 days later, I walked up the stairs. I'm like, wait, what the heck was that? What's going on? And I kind of backtracked. I'm like, let me try that again. I'm like, oh my God, I'm so much better. And the yeah, when I went into heart failure, the cardiologist said maybe in 10 years you can get 10% better. I'm like, that's no deal. And long story short, after less than a year, I walk into his office standing up. And he goes, that's interesting. And he goes, get on the table and did the echo and it's normal. And did he ask me what I did? He goes, oh, that's great. See you in a year, you know? And it was the peptides really reversed it. And the big thing was lowering that human genetic growth factor beta and reversing that fibrosis, which they thought was not possible. But we see that all the time now with, all these chronic multi-system illnesses, chronic Lyme, all the veterans with traumatic brain injury and post-traumatic stress, SEERS, chronic inflammatory response syndrome. And all these are the same mechanism. And it's that, basically you get immune dysfunction, which then results in a vicious cycle, pineal, hypothalamic, pituitary, hormone dysfunction, including the TSH drops. And people, oh, your thyroid looks normal. No, 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 it's not. And that's why you have to look at other tests and look at a lot of things that we'll talk about. You get mitochondrial dysfunction, you get immune activation of coagulation. So basically, you can't absorb nutrients, you can't get rid of waste products. It's just so many things that are a vicious cycle that you need to fix. But if you fix the immune system and give thyroid, a lot of those things get better. And so you don't have to fix this and this and this and this. And all of a sudden, all these things get better. So T3 and immune modulation with peptides, those two things combined, you can treat so many complex illnesses or longevity, from the simple to the complex.
Awesome. That is definitely a story that a lot of people who would like, listening over here would like to listen to, because they have been suffering from several years from Hashimoto's and thyroid disorders. And they have been told nothing can be done about it. They have to live this way. They are already on right treatment, or, like they don't need treatment. So absolutely. But before we move forward into the thyroid, a lot of people might not be aware of these terminology of like either peptides or these bioregulators. So if you can just kind of quickly touch on that, what are peptides and how they're different from these bioregulators, because these are actually even newer things than peptides.
Yep. And it's pretty amazing. And so peptides are basically small chain amino acids. So if they're over 40 amino acids are considered a protein. If they're less than that, they're a peptide. But so most kind of peptides, BPC 157, body protection compound, probably the most common one, lowers inflammation. It kind of does everything, helps brain, healing brain, gut, muscle, joints, all that, orally bioavailable. TB4 frag, immune modulator. So immune modulation with these peptides is key. But the bioregulators are very interesting. So during the Soviet Union, they found that their cosmonauts, their submariners, and their high-speed jet pilots were aging incredibly fast. And they had to keep turning them over. So they went to the military went to Kavanaugh, who was a KGB agent, but a physician head of the gerontology department, who was working along with Pavlov, as in Pavlov's dog, right? So people, associate him with with the bell and the dog salivating, but he was very into peptides. But they said, you need to fix this problem. Like, okay, we will, right? You don't have much choice. And what they found, it seemed like a lucky guess, but it seemed that Pavlov was actually experimenting with this prior. And they found that extracts from young calves, the thymus and the pineal gland, if they combine those two in these rapidly aging, elite individuals in the military, it reversed their rapid aging. And so it was a military secret, and it was only used in the military and the Olympic team. Olympic team did pretty well during that time. And there's currently 21 different bioregulators, probably about 30 actually, when you look at this synthetic and there's natural, but where they have them, they're very tissue specific. So pineal helps the pineal, thymus helps the thymus. They got muscle, they got kidney. Like we're getting people off of dialysis, just giving the kidney bioregulator. They have heart, which is reversing all the inflammation in the heart. They have, so many like different tissues. But they found that especially the thymus and the pineal combined really reversed aging, and that's what we're finding. And long story short, there's also a thyroid bioregulator. Okay, and so we give that to people, and if they're low thyroid, it raises their levels, and if they're high, it lowers it. But the big thing is a thyroid axis bioregulator. So we found that and we improved upon it and did the whole thyroid axis as bioregulators. Now, the thyroid bioregulator doesn't help Hashimoto's. The antibodies just don't change. But with the thyroid axis bioregulator, they dramatically reduce the autoantibodies. And so I'll just it's kind of a little hokey here, but these are this is just a thyroid bioregulator. And you can see with basically before and then after with standard treatment, and then with the bioregulator, increase in T4 and T3. Now, the difference is with the thyroid axis bioregulator, so it has the thyroid with it, but so you see dramatic increase in tasted T4 here. So higher T4 with the thyroid axis bioregulator than the thyroid bioregulator. But the big thing is, so the TSH also dropped. Again, it's backwards so hard. But the big thing is the antibodies. You can see here, so TPO and antithyroid globulin, and here just drop with the thyroid axis bioregulator. And we're finding just the testimonials and reviews are just incredible. People just struggling for forever, and we just give them that, and their antibodies come down, their levels go up, and without even giving thyroid. Although I'd love T3, and that's kind of the formula there from integrative peptides. But it's been quite amazing. We haven't had it out that long, but it's the feedback is just like incredible.
Yeah, that is
And it also
amazing because
boosts mitochondrial function, increases fertility, increases anti-Müllerian hormone. Actually, hormones start basically coming back. So it works. It's not totally specific because of the thyroid axis. It's helping the pineal hypothalamic pituitary axis. But we've been pleasantly surprised, I guess. Yeah, how effective it is.
yeah, and this is amazing because most people have been told that they cannot lower the thyroid antibodies, like in Hashimoto. So if they go to traditional doctors, that's what they have been told. Just kind of keep taking the levothyroxine. You don't need anything else. So this is a very new approach. Like I always tell my patient, there is no magic pill, but looks like we might
Getting
be.
close.
Yes, one
Yeah,
of
the
that magic
endocrinologist
pill.
won't even check the antibody levels because they don't think you can do anything, which is
Right.
crazy. And you've talked about many other therapies that actually can lower the antibodies, and the antibodies actually are shown to correlate with symptoms more than even low thyroid.
Absolutely. So let's talk about that. This whole immune system dysregulation, which is happening in Hashimoto's, and how they're associated with, the symptoms, as compared to the actual, thyroid hormone or TSH, which everybody is relying into. And most
Yeah.
people that come to our clinic, they will say that, well, I've been told that my thyroid numbers are normal, but I don't feel normal. I still have symptoms. So why does that happen?
Yeah, and if you look at when we look at someone with chronic illness, especially with chronic illness, you get immune dysfunction. So there's two sides of your immune system, Th1 and Th2. Th1 gets stuff inside the cell, Th2 gets stuff outside the cell. As you get older, as your thymus involutes, which is why, again, reason the anti-aging with the bioregulators, the thymus was so important, that it starts going like this. You get lots of inflammation, but you can't fight intercellular infections. You get, and with all this inflammation, you get senolytic cells that you can't get rid of, and you get mitochondrial dysfunction, and all these a vicious cycle of diseases of chronic illness. Now, if you can snap that back and have a more healthy immune system, it rewinds all these things. And with the immune dysfunction, what happens is you get dysfunction of the deiodinases, which are what converts the T4 to T3 in different tissues. So type 1 will convert T4 to T3 in general in your body's the system systemically. Type 2 basically mainly in the pituitary, and type 3 will convert T4 to reverse T3. Now with chronic illness, the body will start in decreasing type 1 deiodinase, increase type 2 and type 3. So you get less T4 to T3 conversion in the tissues in the body, but the pituitary increases T4 to T3 conversion and increases T4 to reverse T3 conversion, which blocks the thyroid, but the pituitary does not have type 3. So just right there with the deiodinase difference from the immune dysfunction, you get low TSH and you get low tissue levels of thyroid. Then you add what's called thyroid transport. So it is thought, and I think most endocrinologists think thyroid in the serum, in the blood, will just diffuse into the cells. Not true. It's active transport. And T4 and T3 have different transporter. They're energy, they require energy. Now, the one for T4 requires more energy. So if there's mitochondrial dysfunction, which is associated with any diabetes, chronic illness, inflammation, aging, that you can't transport T4 much more than T3. They both need energy, but T3 much less, which is why T3 is such a better treatment than T4. And then also, like with Hashimoto's, they have the highest percentage of antibodies to the pituitary and also to deiodinase type 2, which you think would knock it down. And so, but it increases it. So they get lowering TSH. So when you look at a sick person that has low thyroid, they have a low normal TSH, not high. Okay. Sometimes they can have high if they're relatively healthy, but a lot of times low normal, and they have a high normal T4 because the T4 can't get into the cell. So what do most doctors think? Well, they're kind of a little bit hyperthyroid. Absolutely wrong. Well, how do you differentiate the low free T3, low normal free T3, and the high normal reverse T3? Now, reverse T3 used to be much more useful when it was done with the radioactive immunoassay, and it would have a much broader range, but they changed it to the more accurate, or really more inaccurate, precise, and just clumped everyone together. But if you look at, so I have high normal reverse T3, it used to be abnormal reverse T3, but low normal free T3 or T3, low normal TSH, and high normal T4. That's a typical picture of a chronically ill, aged, stressed, or if someone actually diets 3 times extensively, that's what happens. It drops your basal metabolic rate, it drops your thyroid level. It does not go back to normal even after you start eating again. So when people say I've wrecked my metabolism, they have, and people go, "Oh, sure, you're eating bonbons in the in the closet." And so we'll check everyone's basal metabolic rate, which is the gold standard, for thyroid. Thyroid's a gas pedal for that, and a thyroflex. So the British Medical Journal showed that a knowledgeable doctor looking at someone's ankle reflex was a better test for thyroid than blood tests. How the hell could that be? Well, normal reflex goes, but the lower the thyroid, the slower relaxation phase. So we measure that via the computer. And we find when someone, and I'm telling you, anyone who can't lose weight, almost all people that come in that have an issue or even stress, aged, chronic illness, inflammation, can't lose weight, probably have around 25% lower metabolism than someone their equal age and weight. So that is what we look at. We also know how to look at the thyroid levels. Another useful test is SHBG, not perfect, but it goes up in relation to the amount of thyroid and estrogen in the liver. Also, inflammation will raise it. Sometimes it's not good. But so let's say a woman is okay, everything fine, her estrogen's fine, or she's on replacement, and her SHBG is 60, right? It should be 80. Well, she's either low estrogen or low thyroid. If her estrogen's fine, she's low thyroid. You'll see that go up. If it doesn't, they have thyroid resistance. So looking at a lot of different tests, I mean, we're just stuck in the dogma of TSH, and the TSH goes down with any chronic illness. And for instance, people will look at suppressing the TSH. They'll look at the Salon article and say, oh, increased risk for AFib. But if you dig down in that anyone who basically was on thyroid, there was no AFib with suppressed TSH. It was all the sick patients that had low TSH that got AFib. So, and a lot of studies show giving thyroid reduces AFib. I'm not saying, you go crazy and give it, you're not going to cause, but also low normal thyroid has increased risk for AFib. But it's that TSH that they're just stuck on. It's just simplistic. We always wish that simplistic works, but it doesn't. It's causing so many people to be misdiagnosed, underdiagnosed, and undertreated.
Absolutely. So you are kind of telling us a very, very innovative approach, of not just looking at T3, T4, and TSH, but there are other ways of checking how well your thyroid is functioning by obviously the thyroflex, which is essentially checking the reflexes in the body, as well as looking at other parameters of basic metabolic rate, as well as the SHBH, which for people, it is a sex hormone binding globulin, which is a blood test, which can be easily done with any other lab. So looking at all those parameters, then you judge a person, thyroid is functioning or not. and that's where, like, you put them on treatment. What is your treatment like, looking like? Just directly they go on this bioregulator you're talking about, or you kind of focus on the diet and the lifestyle and supplements and add the bioregulator? What is
Yeah.
typically your approach?
Yeah, I mean, historically, we're T3 was the treatment, and it worked for so many people. In fact, when I first started in medicine, I just took over a family practice and started doing thyroid optimization. Switched to cash in a year. It was just no marketing. People, lined up outside, and it was just incredible. And so we love T3, and T3 generally works so much better. For instance, the largest study ever done on antidepressants, they actually used T3 and all these different antidepressants. And they didn't expect it, but T3 was shown to be a better antidepressant than the antidepressants. And it didn't matter what their initial levels were, and they had less side effects than antidepressants. Also, another study on 135 bipolar patients, they just gave them all T3. Didn't matter what their levels were, and they found this. They tried on average 14 medications with no improvement. Right, so these are totally treatment resistant. Gave them all T3. About 80% had a significant reduction in symptoms, and 25% total resolution of symptoms. And again, that's just on the depression side. And then you look at, basically insulin resistance, and they all need T3. So T3 is just so much better. But and you look at the problem, and you look at the studies where, T4, T3 was not any better. How much T4 is equal to how much T3, right? If you look in the PDR, which I don't think anyone looks at anymore, but they'll say 5-1 or 4-1 that T3 is more potent. But wait a minute, well, T4 isn't even active. It basically, in a healthy person, about 50% will convert to T3. So it's only 2-1. And so they would do these studies where they would take away, 10 micrograms of T4, and then add, 2.5, or they take away, 20 and add 5. They made them hypothyroid, and their TSH went up, and they go, oh, see, it wasn't any better. Well, actually, they didn't feel any worse, and you made them more hypothyroid, but it's 2-1. And so if you want to convert someone, let's say they're on 100 micrograms of T4, then you want to give, so the equivalent actually is about 50 of T3, but they'll feel much better. So we'll stop the T4, and that will take a little while to come out. So we'll start, low, let's say 25, then 37 and a half, and then go up. And then all of a sudden they're like, oh my God, I feel so much better. Some people, like if they're on like a high dose T3, they may need a little T4, to just basically even it out. But we find T3 is just, for any chronic illness, especially chronic fatigue syndrome, fibromyalgia, any multi-system illness, any inflammatory, depression, depression. And also, they did the studies. They go, oh, well, it's not low thyroid depression because giving thyroid didn't work. Well, they give T4, but every study they gave T3, it worked. So and that it goes back to that thyroid transport and in the deiodinases where you got to give the right therapy, and the right therapy generally is T3.
Absolutely. So that's great. Now, you also talk about, like, antibody negative Hashimoto's, which is a terminology that most people are not even aware of, that for them to get diagnosed with Hashimoto's, they have to have antibodies. So what is this antibody negative Hashimoto's?
Yeah, it was just an interesting study in New England Journal of Medicine. They did thyroid biopsies and people with just fatigue, not chronic fatigue syndrome. They found 60% had inflammation of the thyroid. So, and so basically the thyroid wasn't functioning because of this inflammation. And we're finding again with chronic illness that, T3 is amazing for these patients, but the immune system and the antibodies correlate more with symptoms than the thyroid even. So if you fix that, again, before it was always immune modulators, what we still use, like thymogen alpha 1, not thymosin alpha 1, but that does work too. But and TB4 frag and things, and lowering the TH2 BPC, doing that, they feel so much better even if you don't touch the thyroid, right? And because also Hashimoto's patients have the highest incidence of anti-pituitary antibodies, which lowers the TSH. So again, that makes it so they don't get diagnosed with low thyroid, and also anti-deaminase type 2 antibodies, which you think, okay, well, that would reduce that type 2 so that TSH would go up. No, it just happened to increase the activity. So there's more T4 to T3 conversion in the pituitary. So the TSH goes down. So the Hashimoto's affects so many things. And studies with fibromyalgia patients with Hashimoto's, every single patient, not there wasn't any exception, had significant mitochondrial dysfunction. They also had antibodies to their muscles. So the Hashimoto's is a marker for multiple, basically autoimmunity and really that immune dysfunction. So they'll tend to have much higher incidence of POTS and where you get dizzy when you stand up, and all these different multi-system illnesses, immune activation, coagulation, again mitochondrial dysfunction, can't detoxify, and you fix those, and you fix the autoantibody, and they also get PANS. We found with all the veterans, they all had PANS, which is antibodies to their receptors, dopamine, serotonin, norepinephrine, and you wonder why they're not getting better with the VA. They're giving them antidepressants, antipsychotics, but it's not working because their receptors are blocked. And so we found that in dramatic improvement in all this. They were all special forces, and with immune modulation, and also we found they all had Lyme. Like, what the heck? Why would they all have Lyme? They went to Afghanistan. There's no Lyme in Afghanistan because they went through Fort Bragg in North Carolina, laid in the bushes, training for months, and that's where they all got it.
That's very interesting. So now I'd like to focus on this bioregulator, because this is such a new thing and I think nobody else is doing it. So talk to us a little bit more about this particular thyroid bioregulator. How does this work? And in terms of how is it used by people?
Yeah, so the standard one is the thyroid bioregulator, which is incredible in its own, that it raises the thyroid levels if it's low and lowers it if it's high. It's kind of like, the adaptogen type thing. And then we went farther with it and did the thyroid axis. So all the pineal, hypothalamic, pituitary, thyroid axis, and it's just dramatically improved. And for instance, they don't know there's synthetic versions and the natural. So the natural, they'll basically take the thyroid and then basically purify it and get all the peptides out of that. Then if they identify the active, then you can give that, which is much purer, much more consistent. And because they can only purify down to about 10,000 Daltons, but we're actually going down to like 1,000 Daltons. And so the majority of peptides in there, because the bioregulators by definition are only 2 to 4 amino acids long. Why is that important? Is that they they need to be acetylated and amidated. And it's like BPC. It's a big thing, like stable BPC, which is unstable BPC, because you have the body will cap or acetylate and amidate proteins and peptides that it finds are very important. So it caps them with a group here, a acetyl group, and a group on the ends. Now the body, the enzymes won't recognize that. So now it survives all the gut enzymes. It also makes it much more bioavailable. So when you do a 2 to 4 amino acid peptide, which is the bioregulators. So bioregulators are peptides, but they're a special type. They're short. They can't be over 4. And with that level, most of them are 3 amino acids. They survive the enzymes in the gut, and then they diffuse into through the gut and through the cells and go into the nucleus. So peptides generally work on the cell surface with the receptor. So you attach the receptor and you get secondary effects and pleiotropic effects, so multiple effects, downstream, kind of like a supplement, but more potent. Now the bioregulators work differently. They go into the DNA. They'll attach to basically promoters and inhibitors of transcription. So they work on the epigenetic level. So they will, and interestingly, they'll turn. It's kind of like a little bit like stem cells and exosomes, that they turn off aging genes, inflammatory genes, and they upregulate anti-aging, young genes, regenerative genes. So when they do that, so they work again by turning genes on and off. So they work differently. And when we do that, and especially with the synthetic, or we'll put both extract, and we've isolated a lot of the actives, which no one knows what they are. So we've been working doing that, and much more effective and straightforward instead of just kind of throwing a bunch of peptides, in there, and so you get both the cellular effect, but the big thing is turning off those bad genes, and it ends up modulating the immune system, so their Hashimoto's goes away, and which then is a vicious cycle. Now the mitochondria come back, and the peptides epigenetically increase mitochondrial function, increase the hypothalamic, pituitary function. Well, it will basically turn it back on. So it increases protein synthesis in all these tissues. For instance, the liver one increased protein synthesis and makes the liver start working normally, the kidney working normally, muscles, and all these things. So brain, oh my God, there's so many studies on Alzheimer's and dementia, and even just normal cognition. It basically activates the brain and turns it on, and so it works for all these cognitive defects and things like that. So it's just a whole new area, and it's even expanding even more.
Absolutely. So basically, in nutshell for people, because that was a lot of medical
I
jargon.
know.
But in short, like if you have brain fog, then this is going to be helpful for you because that is definitely going to improve your cognitive function. If you have feeling tired or fatigued, this is again going to be useful for you because this is going to work on all different organs of your body too. Plus, if you have Hashimoto's, it is going to lower your antibodies. And if you have hypothyroidism on top of it, where your thyroid levels are low, it is going to improve them also, right? Did I line up everything
Yeah,
correctly here?
perfect, perfect.
Great. But before the discussion, like you were saying that initially there might be a point where people might see a TSH rising up, but then it finally kind of plateaus down and improves, right?
Yeah, and we didn't expect this so much, but we have people responding saying, I feel so much better, but why is my TSH higher? So if we check it like within the month or so, the TSH goes up because it's activating the hypothalamus, the pineal hypothalamic pituitary axis. And because that's what's wrong with these people with chronic illness and chronic inflammation, or even lack of sleep and stress, that the pineal hypothalamic pituitary axis goes down. So their TSH is low, and that's the problem why the TSH being the determinant of low thyroid is ridiculous, right? And because they're low, so it raises that. So like a normal person, and TSH goes up, and but they have increased thyroid levels, not lower thyroid levels. Where most endocrinologists, I think they think like, well, high TSH must have lower levels. No, it's stimulating them, and then over time it kind of balances out, and then the TSH settles down to something less than, let's say, whatever. Let's say the TSH was 10, it may come back at 2. You want your TSH, even though how inaccurate it is, but if it's over 2, you got low thyroid, right? Not
Mhm.
4. And you look at the bell-shaped curve, and it's like this with thyroid, and so it's not like this where it should be, and this is like 2, and all this here is people with low thyroid. So anything above 2, no matter what everything else shows, you need to treat the thyroid. But and that's will it will end up being below 2. But at the first month, or sometimes the second month too, that it's raised like 4 or 5, and they're like, oh my God, I'm lower thyroid, but why do I feel so much better? But their T4 and T3 levels are higher, and the reverse T3 levels are lower.
The next question, obviously, for any therapy is that how long does it take for people to see an effect or like see a difference in their labs?
Yeah, we're finding about, we don't check it so often, but we wait a couple months, but people are saying after a week or two, they're calling saying, "Oh my God, I finally feel better," and all we gave them was that. Um, and even ones that we don't give any T32, which is kind of pure, right? And you can tell. And the studies show that as well. And we have uh, the Rebecca Ferguson. She has a website with recovery. People are very, very sick, and she's just like, "Oh my gosh, this has changed my life."
That is awesome. So it can show effects very quickly. So that's also good to know for people. And the next question is that, because a lot of peptides are injectable. So is this something injectable or it's something which people can take orally because that makes a huge difference for a lot of people?
Yeah, and as I mentioned, that with the shorter peptides, that if they're less than 4 and they're capped, then they totally absorb, no problem. And even the studies on BPC looking at oral versus injectable head to head, the oral always is equal potent to the injectable. But some people, like injectable, but if they're larger, they're not going to absorb. People are putting like TB4, which is 43 amino acids, in orally, like it's not going to absorb. It's going to get broken down. But the bioregulators, in particular peptides, will totally absorb orally without needing injectable.
And obviously, the last question most people is that, is it safe? They should be worried about any side effects or any major issues, that, this might cause.
Yeah, they've been around for about 40 years, believe it or not. And I mean, there's thousands of studies on these things. It's incredible, but no one knew about them because they were, one, hidden behind the Iron Curtain, and then two, they were in Russian, so no one translated. They're finally translating them, and there's so many studies, and in fact, with a number of these, you can take 1,000 times the dose and no side effects.
Absolutely. I tell people is that, with my patients or my clients, is that these are natural compounds which our body is already making them. So it is nothing that, we are manufacturing out of the blue. Yes, we are tweaking them a little bit, but these are natural compounds. So obviously, they're pretty safe. And as you said, we have tons and tons of research studies. So that is a good thing. So that is again a good reassurance for people about it.
Yeah, and some of the peptides like KPV, which we love, it's anti-inflammatory. It's the last three amino acids of melanocyte stimulating hormone. It raises the immune system, very antimicrobial, and lowers inflammation. And like no one's ever had a side effect, but you give it to like Sears patients and Lyme patients, like they react to anything. I mean, you can give them a placebo, and I tell them, look at it for a couple of weeks, then smell it for a couple of weeks, then lick it, and they'll react. So the first time I've seen any reactions to even those, peptides, but the bioregulators, almost without exception. I mean, sure, there's people that react to water, and we see a lot of those very sick patients, but very, very well tolerated, and any side effect is virtually unheard of.
Absolutely. That's great. That's great. That's good to know for people because obviously they want a reassurance before trying anything new on it. So obviously, we can keep going on and on. We can pick your brain for hours and hours on this thing, and still people would not be able to grasp everything. With this short, like 30, 40 minutes we had, people might have to again rewind and listen to it again and again. Uh, any parting words you have for people, especially with thyroid and Hashimoto's and things?
Yeah, I would just say, the whole key is trying to find a good doctor, as you know. It's very hard to find a good doctor nowadays, hard to find a good attorney, it's hard to find a good dentist, and who's just not in the system of just, okay, this is what we do and the dogma. And there's so much evidence-based studies that are showing that the way we practice medicine is wrong. It's killing us. It's barbaric, honestly. And you find a caring doctor that is passionate. You're going to go so far and basically get so much better. But you have to also take accountability of yourself. There's the days of just listening to your doctor. My doctor says this are gone. You have to ask them questions. And if a doctor says, "Oh, stop, going to Dr. Google," I won't, run from that doctor if he doesn't want to answer your questions. Because we tell people, go to Google. They have, great questions and information, but they also have terrible. So we'll basically talk about it. But if they can't defend their treatments, then run. And they're just lazy, and you need someone who's passionate. And doctors are typically practicing what they've been doing for 30 years or 20 years in residency. So doctors like Dr. Gupta and a lot of doctors on these doctor talks are the ones that are continually going forward and reading the studies and practicing evidence-based medicine, and that's where you're going to get better.
Absolutely. And before we let you go again, can you talk about this bioregulator peptide? What is it called? Where can people find it? And can they use it? Like, do they need a prescription for it or not?
Yeah, and so this one with the thyroid, you can get the thyroid bioregulator a number of places, mostly in Europe, but the thyroid axis bioregulator, I think I'm pretty sure we're the only ones that have formulated that. And it's at integrativepeptides.com, integrativepeptides.com. And so there's section with the peptides. They're all oral supplements, so you don't need a prescription. We recommend you do work with a physician. If you go to the site or a doctor's has a map where you can find a doctor that uses these peptides. And we have a lot of trainings and things like that for doctors. And it's really changed my life. And every doctor we train that changes their practice. And you combine T3 or a thyroid treatment with peptides, you can basically treat almost anything. And even the most complex, like we typically see patients that have seen 15 doctors and really great doctors, but they'll miss the thyroid and the immune, and they don't use the peptides and bioregulators. Just doing that, it's so powerful, and patients are just like, oh my God, is that all it took? And so it's very rewarding and it's amazing what happens with people, and so because so many people are sick, right? And everyone has
Mhm.
chronic multi-system illness. We're being poisoned by the food. RFK, let's go. Right, and and so we got to fight back, and with toxins, and there's with the peptides and bioregulators, they help you detoxify, and they fix all these different things with essentially no side effects.
Yeah, so I will like to leave people is that, if you do the thyroid treatment with the peptides, that can be that magical thing that you're looking forward to because it works at multiple levels, not just one way. So please, again, we will have all this great information about Dr. Like Holtorf, where, his websites and all this description and stuff. So please go and check it out. And then obviously, he gives talks regularly. He's all over the place with tons and tons of information, tons of books he has written and articles. So please, again, if you want to kind of geek out into all this great information, then you can certainly do that too.
But
Dr.
I just want to mention, I'm not guaranteeing anything is going to work. Anyone who guarantees anything like that, and I'll make it sound like that. Everyone is a unique case. You're not a study. You're a person. So does it work? It often does, but there are people that it may not. So
Absolutely. I mean, again, there is no one size that fits all, right? Like in functional medicine or any alternative medicine, that's what we say that, okay, well, you are a unique individual, you have your unique needs, and you need to have different tools in your toolboxes. So this is definitely one of the newest tool that people can incorporate in their toolboxes, which might or might not work, but as you said, there are good results with it. So at least like people are aware of it, and that's the goal, of this summit or all this information that we are also sharing is that there is much more out there that you can do to heal your thyroid.
there is, and you have a bunch of amazing speakers and people with low thyroid. You think like, okay, you can just get your thyroid treated, but but it's so difficult, right, with standard doctors but yeah, all the speakers he has that he's was able to get on this summit are amazing. So I would recommend listen to all of them. And thank you for all your work.
Absolutely. Thank you so much again, Dr. Holtorf, coming over here. It was really, really great. A lot of great information, a lot of insights. So thank you so much again.
Thank you. Pleasure.
All right. Wonderful. All right, guys, this is it for today. We'll see you next time. Bye bye.